When you look at your body in the mirror, are there things you would like to get rid of? Is one of them cellulite? Well, as you know, it's probably one of the hardest things to remove, but there's a new treatment that seems to have some pretty promising results. I want you to meet board-certified plastic surgeon Dr. Ross Stetman of Stetman Plastic Surgery. He's here to tell us all about a new cellulite treatment called Cellfina. Super excited about it, and with him is Belinda, one of his patients who's had the treatment. Welcome to both of you.
Well, thank you.
Okay, so every lady right now just went up to the television saying, what is this new treatment? It's Cellfina, and it's FDA, newly FDA approved. How does it work, Dr. Stetman?
That's right, Jerry. So Cellfina is a great new procedure that we can do in the office. What it does is it actually treats the structural cause of cellulite itself, which are some tight bands that cause dimpling of the skin.
So you said that it's actually, earlier we were talking about, you said it can actually be genetic. So that's just a relief to a lot of women out there that we're not doing anything wrong.
Absolutely. In fact, we see it in patients that are overweight, we see it in patients that are underweight, we see it in all body types. It's genetic, it's potentially also hormonal, which is why we see it more in women than we do in men.
Okay. So is this something that you said is for all body types? So is there an optimal weight, or, you know, what's the criteria for
There really
treating
isn't
it?
an optimal weight. What we want to see is those true cellulite pockets.
Okay.
So we're not treating loose skin, but we're treating the dimpling that's caused by these firm fibrous adhesions between the skin and the underlying tissues.
Okay, so walk us through the procedure. Somebody comes into the office. How does it work? What are you doing?
So the first thing we're going to do is get an overall medical assessment of the patient, make sure that they're a good candidate for it. And most patients are good candidates, you know, as long as there's no active infections in the area, patient isn't on blood thinners and things along those lines.
Okay.
Once we establish the fact that they're a good candidate for the treatment, then we're going to bring them in the office and we're going to mark them. We're going to show them exactly where the dimples are, and then we're going to bring them into the treatment room. We're going to numb up those little dimples, and we're going to basically, with a tiny little needle, cut those little fibrous bands.
Now, what we're looking at here, this is a picture. That's a little rear end cheek right there on the top and the bottom, and that is the first one you see is pre-treatment. The last one you see is 2 years later.
That's correct.
Okay, so this is all done in office and no downtime afterwards. Is that right?
Right. Patients can go back to work the same day. There's no anesthesia or general anesthesia required. There's no narcotic pain medicine required.
This is amazing. Now, this picture here and this picture here, we're going to see all sides here. This is beautiful Belinda, who's brave enough to join us here, showing us her before and after pictures. Okay, did it hurt, Belinda?
You know, when the numbing first goes in, just like a dentist, you get that lidocaine, it numbs it up. But once that was in, I honestly did not feel a thing, not one thing.
Okay, so you went into Dr. Stetman's office. You walked out how long later?
What, with the procedure, maybe half an hour?
Half an hour?
Yeah, it depends on how many dimples you have,
Right.
but anywhere from 30 minutes to an hour.
Okay, so how long has it been now for you since the treatment?
2.5 months about.
Okay,
Yeah,
and those results that we looked at, those are pretty significant after 2.5 months.
Amazing.
Is this one of those that gets better over time?
Absolutely, and in fact, what we found was with the initial studies of this treatment was, you know, initially at 3 months, 6 months, we see patients are satisfied about 85%. But when they follow them up to 2 years, it's actually a 96% satisfaction rate.
Now, I'm guessing that most people get it, you know, on their buttocks and their thighs. Is there any other place on the body you can do it?
No, right now it's FDA approved just for the thighs and the butt.
Okay, wow. That's pretty amazing. And 2 years later, and it's still going strong after that on those pictures. Thank you, Belinda, for coming in and sharing your story. And thank you, Dr. Stetman, for sharing this new treatment with us. And guess what? He's brought along a special opportunity for you, our Sonoran Living viewers. He's offering $500 off Cellfina, the new cellulite treatment. It's at Stetman Plastic Surgery. Here's the address, 9977 North 90th Street. That's Suite 178. That's located in Scottsdale. He does it right in his office. 480-488-3388 is the phone number to make your appointment. Learn more at StetmanPlasticSurgery.com.